Hello, everybody. For those of you who are not aware, my name is Tanner Lapointe. I am a program facilitator with the Schizophrenia Society of New Brunswick. Today, we're going to be talking about a very serious and debilitating illness that unfortunately affects so many people. It's called clinical depression. Let's jump right into it. So what exactly is clinical depression? Clinical depression is a biological brain disorder that is characterized by excessive feelings of sadness, worthlessness, and results in changes in energy and ability. Clinical depression is a biochemical imbalance. It is vastly different from normal feelings of sadness. We all feel sad from time to time. It doesn't necessarily mean we have depression. Clinical depression typically lasts for weeks or even longer. And clinical depression is categorically not a character flaw or a sign of personal weakness. So what are the symptoms? We can break down the symptoms of clinical depression into two major categories. We have physiological symptoms and we have psychological symptoms. So let's talk about some of them. So some of the physiological symptoms: fatigue and lack of energy, excessive sleeping, changes in eating habits. This can mean eating less than usual or eating more than usual. Decrease in libido, and somatic pains with no clear medical cause. Depression often manifests itself physiologically. So the psychological symptoms: sadness, feeling worthless or hopeless, agitation or aggression, anhedonia, which is the inability to experience pleasure, loss of interest, deterioration of memory, thoughts of suicide or death, and sometimes even symptoms of psychosis. In some severe cases of depression, the individual may experience psychotic symptoms such as delusions and hallucinations. So what causes clinical depression? Like most disorders, there is no one specific cause we can point to, but there are some potentially contributing factors. Some of these factors include a genetic predisposition, which is a family history. So if somebody in your family has had clinical depression, you are at a greater risk for developing the disorder. An imbalance of certain neurotransmitters, such as serotonin. A vitamin B12 deficiency can be a precursor to depression. Stress, lack of positive coping mechanisms, and negative thinking patterns. These are all some of the potential precursors to clinical depression. This, of course, is not an exhaustive list. How is depression treated? Clinical depression is often treated with medications. These medications are known as antidepressant medications. The most common form of antidepressant medications fall into a class of drugs known as selective serotonin reuptake inhibitors, often referred to as SSRIs. SSRIs work by rebalancing the levels of serotonin in the brain. Electroconvulsive therapy, or ECT. Electroconvulsive therapy works by putting the individual to sleep via an anesthetic, and their brain is stimulated with electrical currents. These electrical currents induce a seizure, which alleviates some of the symptoms associated with depression. Psychotherapy and cognitive behavioral therapy may also be used in conjunction with medication and/or ECT. Exercise and healthy diet. Getting adequate amount of exercise and maintaining a healthy diet can help to mitigate and manage the symptoms of depression. So I would like to thank you all for taking the time to watch this video today. I hope you found it helpful and informative. For your benefit, in the description, I have included some contact numbers if you're looking for help. I have also included links to various websites if you're seeking for more information about these topics. Thank you all. Remember, recovery is expected.